Okay, I am here with Jerry. Jerry is one of Dr. Wellens' patients. And Jerry, let's just give a little patient testimony so everybody understands what you went through and the success you've had. So, now you came to see Dr. Wellens, and let's just talk a little bit about that, how you were referred to us and what you came to see us for.
Okay, I've been under the care of Dr. Olga Lupchin in Sebring for about 4 years, and I had a situation on a toe in my right foot uh, where Dr. Olga, after ordering an MRI on me, she still wasn't sure and wanted a second opinion on that. In addition to that, I have neuropathy, severe neuropathy in my veins for a great number of years. Uh, where Dr. Olga wanted me to consult with Dr. Wellens on a laser treatment. So that's how I was introduced to and referred by Dr. Olga to Dr. Wellens.
Okay. So, those of you that don't know Dr. Lupchin, she is a podiatrist in Sebring, Florida, which is an hour and a half away, which is not really just down the street. So, what were your thoughts when Dr. Lupchin said, "Hey, I want a second opinion, but it's all the way in Winter Haven"? What were your thoughts on that? Have you heard of Dr. Wellens, or did she pick this Winter Haven because she likes the city, or what was the reason she sent you?
I had not heard of Dr. Wellens before. Dr. Olga said that she was a foot specialist and she highly recommended that she needed this second opinion. At the same time, she wanted me to have this consultation with the laser treatment. Well, with the pain I've been going through over the years, a drive to Winter Haven was worth it if it meant that I would get relief from this pain. Plus the fact if it would help her assess the problem with my foot
Right.
by having this expert opinion on it, I'm all for it. Dr. Olga is a very good doctor, and for her to say I need a second opinion, I thought was terrific.
Okay, great. So then you came to see Dr. Wellens. Dr. Wellens took a look at the MRI, the X-rays, and what did she find?
Um, Dr. Wellens said it was a hammertoe, that there's a tendon under the toe that keeps the toe flat that was ripped, and that we had to discuss surgery on it. Because of the way the hammertoe was, I was going to be open to future issues constantly until it was corrected. It just so happened that right after matter of fact, the day after I met with Dr. Wellens, I took a trip to New Orleans. And because I feel no pain in my feet, walking in the quarter for an entire day, I felt no pain of a blister that developed on that same toe in the same joint that we were talking about. And it wasn't until the end of the day, into the night, that I took my shoes and socks off that I saw how bad it looked. I waited the week before, because I was in New Orleans, before seeing Dr. Wellens again. I saw her right when I got back, and Dr. Wellens was very, very concerned about what she saw on that toe, and said she ordered an MRI right away, which indicated there was an infection. Not only an infection, it was MRSA, and it was indicating that it was in the bone, and she said, we have to get into this right away. We can't let it travel any further into your bone system. So, within a couple of days we had the surgery and moved on from there.
Great. So normally, one of the questions I ask is, on a scale of 1 to 10, what's your pain level? But in your case, you didn't feel anything, which is the reason why you probably got an infection, because obviously there was something wrong down there, but you could never feel it. A lot of patients, or most of our patients, they do experience that pain, and they just live with it, they deal with it, and then eventually it gets infected, and then they have to come in. So, luckily, we were able to catch it, before it got worse, because you didn't lose your toe or anything, right?
I did not lose my toe.
Right.
It was saved. That was another concern of Dr. Wellens, was whether we were able to save the toe or not, and she did a marvelous job.
Right, because you are diabetic as well.
I am diabetic. In regards to the pain, both Dr. Olga and Dr. Wellens said I should have been in intense pain by what happened with that toe.
Wow.
I didn't feel a thing, and only because of the issue I had a couple of years ago with my foot, my left foot, did I move on it right away when I saw the swelling that led me to Dr. Wellens and to the surgery that it required.
Right. So that surgery was how long ago?
I believe it was June the 11.
Okay, of this year. So
Of this year.
2 months ago. Okay, great. So now the infection's out, Hammertoe is fixed, so now you're good to go?
I'm good to go. I'm already back on my normal routine of activity. Um, she did a terrific job. You could barely tell that there's an incision there. The toe, except for a little bit of swellingness, she said, which is normal, and it'd be like that for another 6 months. Looks fairly normal. There was another spot that was of concern. It's all taken care of. We're good to go.
Good. So, of course, whether had you had pain or no pain at all, would you recommend this surgery?
Absolutely. Well, you have to. I think each person needs to decide on themselves on surgery. In my case, yes, it was the right thing to do. Having Dr. Wellens do the surgery, looking back on the whole event, I'm telling you what, I was in good hands. I think she is so accomplished and sharp and smart, and I have to give it to her entire staff. Everyone was pleasant, informative, either in person or on the phone. If they said they were going to do something, it was done. Very good dealings with the entire staff.
Well, great. We appreciate that. Thank you. I'll make sure Liberty knows. So, yeah, we appreciate you as a patient, and, of course, the doctors always say if we have a patient that listens and pays attention, then that's the number one thing. Otherwise, they can't get their job done without you doing your job. So you have to really just obey what she says and do the process and do the steps, and that's what you did, and now you're better now. So
I am.
I'm glad, and congratulations.
Thank you.
Thank you.
All right.